All right, we'll go ahead and get started. So thanks for everybody for logging in here. Thank you for your time. We definitely appreciate it. I am Dr. Chris Williams with Regenexx Cayman. So I have the pleasure of being able to speak to you about Regenexx Cayman and some of the procedures that we offer, including our advanced culture expanded stem cell procedure as well, which we'll get into. So we have a slideshow that I'll go through that'll highlight all the key points for the different things that we offer in terms of treating orthopedic conditions. And then we'll have some time for a Q&A at the end of the slideshow. So if you have any questions, please throw them into the chat or the Q&A box at the bottom of the Zoom here. And then we'll get through those at the end and address everyone's questions. If there are any technical issues, please just let us know. So we'll go ahead and get started. All right. Well, thanks again, guys. So this is Dr. Chris Williams, one of the physicians here at Regenexx Cayman. I have the pleasure of talking about stem cell therapy and Regenexx procedures and how they may be the appropriate condition for you. So we have a couple of slides to get through, and then we'll get to the Q&A at the end. So this is kind of a lay of the land of what we'll be discussing today. So this is really the first point of contention here. So do any of these things jump out at any of you on the call today? So most people have had some experience with knee pain, joint pain, stiffness, difficulty with quality of life, doing day-to-day general activities, or want to be healthier and active, right? You want to achieve different goals, whether that be run a marathon or simply take your grandchildren to the park or go up and down the stairs without significant pain. So if any of these things sound familiar, then you're in the right webinar, and we definitely have some options for you to help you improve your quality of life. So what's Regenexx? So Regenexx has been around since 2004. Regenexx is a interdisciplinary orthopedic group of specialists that has locations throughout the world, and we have over 100 locations in the United States alone. And the Regenexx providers have advanced musculoskeletal training and specialize in treating everything from degenerative spine conditions to arthritis in the joints, such as the toes or ligament and tendon tears as well throughout the body. And we publish a lot of research, particularly we published roughly about 40 to 50% of the stem cell research to date that's been published throughout the world, and also some of the largest papers on safety for treatment with biologics such as PRP and stem cells also. At our clinical site here in the Cayman Islands, we have 6 rotating physicians as well as myself. I'm the medical director here. Just briefly, a little bit about myself. I am originally from Jacksonville, Florida. Air Force veteran. I went to the Air Force right out of high school and did that for 4 years, lived abroad, served in the Gulf War II as well, and did all of my medical training, medical school, and residency at Emory University in Atlanta, Georgia, and fellowship training as well in Colorado at the Centennial Schultz Clinic with Dr. Centennial and the crew out there, where most of these techniques were founded and created at also, and maintain my faculty position at Emory, where I teach, and I have a practice in Atlanta as well. So I have a very diverse skill set of individuals that are very highly trained and motivated to allow people to get back to doing the things they love. So we kind of briefly touched about this, but Regenexx treatments can allow you to treat multiple things involving musculoskeletal injuries. We really focus in on orthopedics. We're not trying to treat individuals that have, whether it be multiple sclerosis or erectile dysfunction or vampire facials or anything like that. Not to say that biologics don't have a place in the treatment of those conditions, but we are specialty trained with treating orthopedic and musculoskeletal conditions. So what can be treated? So the list is pretty broad and pretty variable. We treat everything from the most common things that walk through the door, usually typically being arthritis, typically of the knee. But we see a lot of people that have conditions such as degenerative conditions of their spine, herniated disc, slip disc, arthritis of the spine, or even avascular necrosis of the joints, particularly of the hip after steroid use. Tennis elbow, golfer's elbow, ACL tears, rotator cuff tears. The list is very broad. So anything involving the orthopedic system, we treat. And not everybody is a candidate, but that really depends on after we have a one-on-one assessment with you, with a review of your imaging, physical examination as well to determine candidacy. But from a candidacy standpoint, once we determine the appropriateness anything within the orthopedic realm is going to be usually a candidate for treatment. So now we can get into some of the nuts and bolts of what type of treatments that we offer. And the first one and the most common one, and also frankly the most well-studied one, is going to be something called PRP, which is platelet-rich plasma. And what platelet-rich plasma PRP is where we take some blood from a vein in your arm, and blood contains red blood cells, white blood cells, plasma, and platelets. And platelets are one of the initial healing cells in the body when we have an injury. They're like a first responder, right? And so the best example I always tell my patients is that if I was running down the street, I fell down and I scraped my knee up, the first thing that happens is I'll bleed. And when I bleed, I get a scab that forms almost within the immediate reaction or within a couple hours. So that scab is 100% platelets. Those platelets then produce about 2,000 different growth factors that promote tissue healing and regeneration. So when that scab comes off in about 2 to 3 weeks down the line, the tissue underneath is healed. The problem with the musculoskeletal system, whether it be the disc in the spine, the cartilage of the knees, the meniscus, or certain tissues, the tissues have very poor to little to no blood flow. So when we have a tear in the disc or we damage the cartilage, these turn into chronic degenerative conditions because the body can't mount a healing response. So the premise with PRP is that we take the growth factors from the platelets and inject them directly where the tissue is damaged under image guidance, whether that be with high definition ultrasound or with fluoroscopy, to get a healing response and to allow the tissue to heal and get better. So it can be a great option. It is not pixie dust. It does not work well for everything. So typically PRP works better for small or partial tears, or if there is mild to moderate osteoarthritis. But also when you talk about PRP, the quality of the PRP and how it's produced is important. So you can have a very simple PRP system that most clinics may use at the bedside, where they just take the blood, take 1 or 2 tubes of blood, put it in there, and they get some platelets back out that's not very concentrated. That will be depicted in this second vial here as well. So we typically like to have a very concentrated, uh, concentration of PRP, because the research has shown that the concentration and dosing matters, because when you don't have enough platelets, you don't get a good clinical response for healing. And a good analogy I always talk to my patients about is, well, if you think about this, if I had a fever, I cannot take an infant's dose of Tylenol, right? Or Motrin. I have to take an adult dose to give me the appropriate dosing of the medication to get a clinical response, right? So that's the same thing with PRP and platelets. If you don't have enough platelets, it's simply not going to work. So when you have a very cheap and non-sophisticated bedside machine, it really does not concentrate the platelets enough to get a very high dosing. So this is about 2 times concentrated. With Regenexx, we're typically in the realm of 10 to 14, or sometimes up to 20 times concentrated, depending on the age of the individual and also the problem that we're treating, to make sure we can get you a good clinical response. All right, so the next biologic that we'll talk about is the same day procedure. Theme, the term SD, which means the same day stem cell procedure. We have a same day bone marrow concentrate procedure and also an adipose procedure, and that's a stem cell procedure. So what's the difference between a stem cell procedure and a PRP procedure? So stem cells are really the basic cell that turns into multiple different cells and tissue types within the body. So typically with the bone marrow, we take the bone marrow from the back of the pelvis, and bone marrow is like a soup. It contains platelets, red blood cells, white blood cells, a couple of different types of stem cells, such as hematopoietic stem cells, which give rise to your red blood cells, your white blood cells, and also mesenchymal stem cells, which is the one that we're most interested in because that gives rise to new musculoskeletal tissues like ligaments, muscle, cartilage, and nerves. Also, so what we do is we take the bone marrow, we concentrate it just like we do with the platelets, and then we're able to use that to then hone in to treat certain advanced degenerative conditions and injuries within the orthopedics and musculoskeletal system. The analogy I tell people about stem cells is that I usually equate them to like a general contractor. When you put a stem cell in an area of injury, it tells other cells and tissues what to do. repair this, do that. But the interesting thing about a stem cell is that it's an immature cell and can turn into new tissue itself. So that gives it really the highest healing potential also. So that's really the interesting thing about a stem cell that's different than a platelet. Platelets produce growth factors that then influence the environment to promote healing. Stem cells can turn into new tissue. Okay. So C, Regenexx C just stands for cultured. So that's where we take that stem cell procedure to the next level. So when we culture stem cells, what we do is we take that bone marrow that we mentioned, or fat tissue as well, and we take the mesenchymal stem cell out of the bone marrow in the laboratory and grow it to millions of cells. Roughly, when we're injecting the non-cultured bone marrow procedure that we mentioned, the SD procedure, we're injecting roughly about 100,000 stem cells within that bone marrow. When we culture out stem cells, we're typically injecting 50, 60, 70, 80, sometimes 120 million stem cells for treatment. So that gives us typically 100 to 1,000 fold increase in the amount of MSCs we're actually treating for different conditions. So when we have patients that have multiple different areas of degeneration or injury, or want to do some cell banking, which we'll get to in a few slides here as well, this procedure becomes very important for that. Stem cell banking, as I just alluded to. So this is the process of where we actually take the bone marrow and take the mesenchymal stem cell out of it, and then we freeze it or put it into cryopreservation. So it allows you to have your stem cells readily available at any point over the years if you experience an injury. We have a lot of athletes that do this, or in general, people that want to remain active and not having issues currently, but they have a certain activity level that they know that injuries at some point will show surface and show their head. So they want to have something in the bank, so to speak, so that way they can use these cells when the time arises as well. So Regenexx C is down here at our clinical site at the Cayman Islands. So you may be wondering, well, why can't we do these procedures in the US? Why do we have to go all the way to the Cayman Islands? So at this point in time, the FDA puts forth certain regulations and rules. And when you are culturing stem cells, the FDA does consider that to be making a drug. We used to do these procedures in the US up until about 2008. And the FDA said, hey, Regenexx, you guys cannot do that. You need to go through a clinical drug trial, which is a phase 1, 2, and 3 clinical trial, which can cost anywhere from $50 to $100 million per indication, meaning that if you do a clinical drug trial, you cannot just get blanket approval for stem cell approval for all orthopedics. It has to be for knee arthritis, particularly mild to moderate knee arthritis. Then it'll have to be for shoulder rotator cuff tears, etc. So it becomes a very laborious and very expensive process to do that. So that's when we decided to take our stem cell culturing process to the clinic in the Cayman Island site. And we've been here since 2011 and published a lot of research and have been treating patients since then, focusing in on truly on orthopedic issues as well. So we kind of talked to this point a little bit here previously. So what's the difference? So there's more, as we mentioned, when you have the non-cultured stem cell procedure, we're looking at roughly about 100,000 stem cells. Whereas here, we're typically injecting anywhere from, 10 to 150 million stem cells. So that gives us enough material to be able to treat multiple joints at the same time, which we don't have that luxury to do in the United States. So if I have a patient that I see in my Atlanta practice that has bilateral knee osteoarthritis that wants to get both knees treated, I have to stage that procedure, meaning that I'll treat the left knee, they come back in 3 to 4 months, I'll treat the right knee. Because you can't get into a situation where you're robbing Peter to pay Paul, right? Because there's only a finite amount of stem cells that we have in the bone marrow as an adult. And so you need a minimum number to adequately treat one knee. Once you try to split that into multiple joints treated at one time, your outcomes are going to suffer from that as well. So we typically have to stage things, whereas here we can typically and commonly treat 2, 3, 4, 5 different areas off of one different aspiration at the same time. And then also we get to bank ourselves for future usage as well, which is a great benefit to have waiting for you whenever you need them. All right, so now we get to look at some pretty pictures. So here are a couple of slides that really elucidate the fact that we can actually not only get pain better, but we do see tissue healing and changes on pre and post treatment MRIs. So we'll have a couple of different examples that we can talk to the fact of what happens when we do these types of treatments. So this is the patient that we actually treated their lumbar spine, as you can see, for a severe herniation of the disc, very large herniation. Had multiple herniations here at L405 and L5S1. The L5S1 is the most significant with a very large extrusion and tearing of the disc. And then after treatment, the patient is actually a European basketball player, was able to get back to sport activities and day-to-day living without any pain. So he's having severe back pain and leg pain, and his MRI improved significantly, as well as his functional improvement with his symptoms as well. So awesome outcome and very impressive picture there of post-treatment after a lumbar spine treatment. Next, we have a additional MRI with the L3, L4 disc herniation, as you can see here. This is the L3, L4 disc here. Pre-treatment, both of these images on top to bottom. This is the herniation that's pushing back against the nerves in the spinal canal here. You can see them being squeezed here, and that's tearing in the disc as well. And this is the post-treatment where you can see that disc herniation has receded back, which then relieves pressure on the nerves in the spinal canal. And we don't see that tearing in the disc also. So this is a very impressive picture as well, showing significant imaging improvement, not only just functional improvement, but actually imaging changes post-treatment. Here is another treatment in the neck. So this is the cervical spine where we had a patient that was treated after intradiscal, meaning that we put the stem cells directly into the disc for a disc herniation, as you can see here. And that is significant when we talk about the cervical spine, because when we have large disc herniations there, it can really cause damage to the spinal cord and cause an injury like, per se, Christopher Reeves, where you can have significant damage to the spinal cord. Or if it's on the side, you can see it pushing in on the nerves here as well, causing what we call radicular pain, where it radiates down the extremity. So this was before treatment, and here's after treatment, and you can see significant reduction in the size of the disc herniation as well. So pretty cool picture there also. All right, so this is the shoulder. So this is a shoulder MRI pre and post treatment. So this MRI has a couple of different things with it. So on the left, we have the pre-treatment MRI, where we see a lot of fluid within the bursa going all the way down here. Here is the humerus, which is the shoulder bone here, the arm of the upper extremity connects to the scapula, which together they form the shoulder joint. And here is the supraspinatus that comes along here. It looks like a bird's beak. And normally it attaches right here where this arrow is, but instead of attaching, you see there's a space with white fluid where it's torn. As well, when we talk about rotator cuff tears of the shoulder, 75% of rotator cuff tears involve this supraspinatus tendon. So we have a complete tear, which means a full thickness tear. And then we see post-treatment, after the patient had 2 injections with the Regenexx same day or stem cell, non-culture stem cell procedure, where we see there's complete healing of that rotator cuff tear, where the tendon is actually now reattached back to the bone and it's healed. So phenomenal outcome and great picture. All right, we have another spine image with a large disc herniation with significant before and after treatment images here as well. So on the before side, we can see that this patient has a large disc herniation at L405. Definitely a surgical candidate, but sometimes if the patient is not having severe symptoms, meaning that they're having changes in their bowel or bladder function, having accidents or incontinence, or they're having significant atrophy or weakness of the muscles or severe pain, it's always, okay to try and usually recommended to try more conservative treatment as well, with the biologic being a very good option for that. So this patient had a very large disc herniation before treatment, and we can see afterwards the disc herniation essentially has resolved. This is an axial cut where we're looking down onto the disc right here, and you can see this disc herniation here pushing back against the nerves in the spine. And now, after treatment, that disc herniation has resolved, and we can actually see the spinal canal with the little black dots being the nerves in the spine. So, again, phenomenal pre and post treatment image showing significant quality of the improvement as well. So, here is a hip labral injury tear pre and post MRI treatment. So, hip labral injuries are significantly important because most of the time the surgical options for treatment are just not very good. If there's an absence of significant osteoarthritis of the hip, which this patient does not have a lot of arthritis, then typically, arthroscopic surgery to repair a torn labrum just does not have good outcomes. So what we see here is a hip. This is a side shot of the hip, or we call it a sagittal. Here is the ball of the hip, because the hip is a ball and socket joint. So the ball being the femur, which is the thigh bone, and it connects to the pelvis up here. And then the labrum is this black triangle here. The labrum is like, I always give the analogy, it's like a plunger. So it extends out from the pelvis to grab on to the ball of the joint. So it grabs onto the femur to hold it in place. So what happens is when you have a tear in that labrum, you have instability and pain of the hip, which over time, if uncorrected, it leads to osteoarthritis of the hip. So here's the pre-treatment where you can see this small white dot within the labrum there, which is the triangle, and that it has significantly improved and resolved. So no more labral tearing there as well. So significant improvement, and that's important because if you don't fix a labral tear, it will lead to arthritis. It's like having a loose lug nut on a tire and continuing to ride that tire and wheel for 100 miles. Eventually, it's going to damage the tire and lead to destruction of the wheel. All right, so here's another pretty good MRI where we have meniscus injury and tearing of the meniscus, pre and after, or before and after, pre and post treatment. So here, what we can see is tear here, where this blue arrow is before treatment, and then after treatment, we see that tear is healed, the tear being the white line right here going up and down, the vertical line as well there. And then here is the resolution of the tear. Also, it's actually more of a cartilaginous injury versus meniscus injury. And then here is actually a cartilage injury where we see thinning of the cartilage here in the knee. And then after treatment, we can see improvement or regeneration of the cartilage. That's not something that we see 100% in all cases, but typically, based on the research and what we've seen clinically, is that you can see about 15% regeneration of cartilage that can happen and be seen on post-treatment MRIs. So what's the difference between Regenexx and surgery? So here's kind of a comparison between the two. Both, when we're talking about treating orthopedic or musculoskeletal conditions, both are, very successful to a certain degree, and some treatment options are much more successful for Regenexx, and some patients are not surgical or not Regenexx candidates and may be better suited and served with surgery. But when we look at the Regenexx options, these are done in the clinic typically. We're not doing treatments in the ambulatory surgery center or in the hospital. And why is that important? Because it helps keep the cost down and also helps to decrease the infection risk as well. These are all needle-based procedures. There's no scalpel incisions typically used for these procedures. And also the post-treatment pain is manageable. Typically, most people are taking pain medication for somewhere between 1 to 2 days. And then they may need Tylenol after that or nothing at all. And it's a very simple recovery process overall in comparison to surgery, where it may be 6 weeks to 3 months before you're out of the significant pain and getting to the recovery portion, depending on what the surgical procedure is. Complication risk. Whenever I talk to patients about these procedures, I always tell them that there is nothing in life without risk of complication that is invasive, meaning that even with getting a flu shot or getting a blood draw, anytime a needle pierces the skin, there's always risk of infection, bleeding, or injury. However, when we compare that to our surgical counterpart, it's significantly lower, where we see, most of the complication and risk that we see are much less than 1% as well. So Also, the recovery period, we always believe that in order to to significantly impact and get the most out of the procedure, you really have to focus in on the biomechanics. So, doing physical therapy after these procedures, just like our surgical colleagues, is imperative to get the best outcome. So, whenever we can, we try to get a good assessment of the biomechanics to really focus in on the things that led to the problem. These things don't happen in a silo. They don't just pop up and happen one day unless there's a traumatic trauma in nature. But 80% of all the musculoskeletal injuries that we see and complaints are not acute trauma related. These are chronic degenerative conditions typically. So there's something that led to these things happening over time. And when we have chronic injuries, we all develop compensatory biomechanical things that help us to deal with these on a day-to-day basis, but we need to really address those to get the best long-term outcomes as well. But with that being said, the recovery is very short for the most part. On average, most patients are back to their baseline in about 1 to 2 weeks, and then we start physical therapy at about 2 weeks out for the next 4 to 6 weeks. Sometimes we're in the brace for that period, sometimes not, depending on what's being treated. Whereas with surgery, you may be out of work for 3 months if you have a knee replacement, or if you have a shoulder rotator cuff surgery, it may be 6 weeks before you can even move the arm. So there's significant difference in terms of the recovery period. And then what we're doing is we're trying to repair, regenerate, and cause an environment that's amicable for healing and anti-inflammatory response as well. Whereas with surgery, it's a resection of tissue for the most part, whether that be a knee replacement where we're implanting a prosthesis, which is a joint amputation, or if we're talking about a meniscus tear where we have to cut out the torn tissue. Our job is to maintain and preserve your native tissue so we can overall improve your long-term functionality of the tissue. Recovery and return to activity. So we kind of briefly talked to this point here, but we'll kind of go into it a little bit deeper. But after the injection, you are taking it easy for the first day, right? You're not going to go out and run a marathon after you have any procedure done. And that's the same with this. But after about a week, you're pretty much kind of rocking and rolling a little bit, getting back to baseline and doing your day-to-day stuff as well. So, typically if I have a patient that their thing is whether it be golf, pickleball, tennis, I usually give them somewhere between 4 to 8 weeks before they're back to their sport activity. With the caveat, if I have professional athletes, it's going to be a little bit different of recovery because we typically will get an MRI to make sure that they have returned to clearance for their sport before we give them full clearance before that. And these things take a little bit of time. It's not like a steroid injection where you do an injection and 24 hours, 3 days later, the tissue is feeling great. But that's the problem with steroids. They don't fix things. So after 4 to 6 weeks at best, the pain is back or worse than it was before. So with these things, we're actually trying to get the tissue to heal. So even though things may feel back to baseline after about 1 to 2 weeks, the tissue is still healing. So, and it takes roughly about 12 to 16 weeks for the body to go through its healing process. And then and you still see significant continued improvement. That happens really over the next, 3 to 6 months. Sometimes improvement can plateau at about 6 months to 1 year. And most people, once they are plateaued, their improvement continues, typically for multiple years. I just have a patient that I saw back in my Atlanta office about 3 weeks ago. I had treated his low back for disc herniation and arthritis and degeneration 7 years ago. And he reached out to get his knee treated. And I asked him, well, how's your back doing? He said, great, I can work still. I was considering an early retirement or a lumbar fusion before I got treated with you. He had PRP at that point in time. So at that point, we knew that he had sustained a great amount of improvement after one treatment. It's been 7 years. And that's what we see in the literature when we look at the research that's been published for these treatments options in terms of how long the improvement lasts. It varies as to what we're treating and what the treatment is, whether it be PRP, stem cells, etc. But we see that these things are long-term treatment options and not just a very fleeting or short-term kind of masking of symptoms and pain. So why do patients choose Regenexx Cayman? We talked about these points, but just to reiterate, we have a very high dose of stem cells, meaning 100 to typically about 1,000 times fold. You can treat multiple different areas. which then allows us to treat more severe conditions, meaning severe osteoarthritis, large tendon and ligament tears, allows us to avoid surgery when patients are appropriate and an appropriate candidate for it. And then you can bank your cells, which is always great to have them at your disposal when you need them. And these are your cells, they're not from other people. And we can always get into the benefits of using your cells or umbilical cells or Wharton's jelly and these other type of treatments. What's the difference and why your own cells are better as well. And then we're able to tailor your treatment plan specifically for you. So this is not a one-stop shop. When you see a Regenexx provider, we spend a significant amount of time with you. We go over your imaging, come up with a precise, tailored treatment plan specifically for you. And all of the injections that we do in treatments, these are all image guided. Nothing is done blind. We use a combination of high definition ultrasound and live x-ray guidance with the fluoroscopy machine as well. And we pride ourselves on making all of our outcomes data public and also publishing research, because that's the only way that the field gets better. And we're able to get these things and procedures covered by insurance that one day by having things published. So, Regenexx is the only procedure that's covered by self-insured employers in the United States. We have about 3,000 employees that provide access to these procedures at no cost other than their deductible. And that's over about 2 million covered lives we have, because we have the research to support that these things work just as good as surgery in most cases, with significant cost savings of benefit and also quicker return to employment. So the research is really what drives those things, allows them to be covered by different insurance carriers. And we're all board certified, meaning that we went to medical school, fellowship training, and have board certification as well. And with the Regenexx Cayman, who wouldn't want to get a procedure done in the Cayman Islands, right? So sunny, windy, beautiful resorts, beautiful beaches, a lot to do, whether that's beach-like activities, water-based sports, fine dining and restaurants. The destination has it all, so it's also a plus there. This is actually a testimony from NFL quarterback Ryan Tannehill, who we treated and actually has his cells banked here as well. We'll get that sent out to you via email. I won't play it now because it'll distort and you won't be able to hear the sound. But we'll get that to you for your viewing at a later date. And also, we'll send you some videos also of looking at why we can do a virtual consult and how that may be beneficial for you, where we sit down, go over your history, look at your images using a screen share as we're doing right now, where I can review your MRI, your CAT scans, your x-rays with you, tell you what I see, and then come up with a thorough treatment plan so you can have a good idea of what's going on and why this may be an appropriate treatment for you also, from the safety of your own home, on your couch, or at a desk. All right, so that wraps things up. So here are a couple of important numbers for you guys. We'll get these to you via email as well. If you want to send us an email, give us a call to reach out to schedule a telehealth appointment, or just for further inquiries about, are you a candidate, or questions about the logistics of things, we're happy to answer and address those as well. Okay, let me see if we have any questions here. Anything in the chat? I currently do not see any questions. I'm going to open things up for questions. So I'm going to allow you guys to be able to chime in and ask any questions that you may have. If you want, you can do raising of the hand by looking at the menu bar at the bottom, or feel free to unmute your microphone and shout out a question. Happy to answer.
Hello, Sue here.
Hello, Sue. How are you?
I'm doing great. I was curious, the Cayman technique versus, let's say, going down to Denver, you actually have to schedule 2 visits, if I recall correctly. Can you describe the protocol?
Absolutely. So let's jump into the logistics here. So when we talk about the Regenexx C or Cayman procedure versus going to Denver, where we have the same day procedure, which is the non-cultured stem cell procedure, where based on the current FDA guidelines, everything has to be done within a 24-hour period when we do those procedures in the United States, because it's a non-cultured procedure. Here, we have to do the procedure over 2 visits to actually grow and culture the stem cells out. So that's a great point. So first, you come down for the bone marrow aspiration. That's a quick trip. It can be done in really about 2 days. And then after that, as I mentioned, we have to pull the stem cells out of the bone marrow in the laboratory, and then we grow those to millions of cells, and then we freeze them. That takes us about 4 weeks to do. You can come back to utilize those cells at any point in time after that 4 week period, whether that be right at 4 weeks or 4 years later. At that point, the cells are in cryo and being banked at that point, and they can be used any point thereafter. So, very good question.
You said something about because of such great research, you have some insurance that will pick up the tab for some of this. I had stem cell injections 3 years ago, and there was no insurance options at that time. Is that still true?
Yeah, so that's a good question or clarification point. So insurance coverage is through the self-insured employers. So that will be your big
Gotcha.
companies and corporations like Amazon. We have right now 7-Eleven, the Meredith Corporation, several different counties. We have the county of Gwinnett as well. And so they provide this coverage through their employees because self-insured employers are on the hook financially. They directly cover the cost of all of the medical procedures for their employees. Through your private carriers in the United States, there is no current consistent and ethical legal coverage for biologic procedures at this point, unless you're treating a cancer.
That's what I thought. Thank you.
Thank you. I do see a question here from Laverne Jackson. So Laverne has a question of, is there a separate cost for banking sales? Great question. So the cost for banking sales is different, and we can get you some specific pricing on that. So if you have the sales bank, there is an annual charge of about $450 to actually bank the cells if they're not being used. And then for the aspiration, there is a charge for that as well, but the clinic can definitely get you specifics on that. That's a great question. Thank you for that, Laverne. Well, I guess I can also just quickly get into the types of stem cells, whether we talk about umbilical stem cells versus your own stem cells. So we have typically two different types of stem cells that we talk about, whether it be from you, which is autologous, or from someone else, which is allogeneic. So the most common one from someone else would be umbilical or Wharton's jelly stem cells. So why do you use your own versus someone else? There's pros and cons to both. The pros for using someone else's is that it takes out the need to have an aspiration done, and everything's kind of done in one foul swoop. The biggest con to that is that, we know that based on the published research to date, that these cells are not consistent in terms of how long they stay in the body, meaning that the body recognizes these cells as foreign tissue and typically removes them over the period of a couple of days. Whereas we look at the research for your own stem cells when they're injected and used for treatment, we typically see these cells are maintained for several weeks to months, and the outcomes are typically better when you compare the two head to head. Typically, that's been done for knee arthritis, and we see that the outcomes are better when we're using our own stem cells and not stem cells from someone else. So that's kind of the biggest difference with those different types of stem cells that we can use. Do we have any other questions?
Based on your research, do you think that anybody in America is going to let us do stem cells legally the way you do them in the Caymans with harvesting and culturing?
Yeah, that's a good question. That's been kind of a hot topic, and it's always been annually, it's going to be in about 5 years. So there's been some recent legislation in Florida that may or may not allow that sooner than later. But right now, looking at the national landscape in the United States, it's still going to be through the same process of getting clinical drug trial approval. And just for an example of how long that actually takes, there's a company called Mesoblast that's been doing a clinical drug trial for using other people's stem cells, allogeneic stem cells, for the treatment of disc herniations in the spine for about a decade now. They were doing that trial when I was a resident at Emory, and they're still doing it now. So it takes a long time. So, and the short answer, I'm not sure, but there may be some new legislation coming down the pipeline that may streamline the process and make it easier. But at least for now, we do have a great option with our clinic at the Cayman Island site. So, good question. Well, if we have no other questions, guys, I am going to pop off and go see and take care of some patients. It's been a pleasure. Thank you for allowing us to talk to you about this and spending your time with us. So, thanks so much, and we look forward to hearing from you and happy to address or answer any other questions that you may have. Just reach out to us, and please take care and be safe.
Thank you.
Thanks.